Hi, I'm Esther from Skylark First Aid. This video today is about the primary survey. Now that's the posh phrase that we use to find out if somebody is conscious or not, and then whether they're breathing or not. So we call it the primary survey. It's the first thing that you look at if you find somebody that's collapsed or you see somebody collapse in front of you. So we use the letters D-R ABC, Dr. ABC. We've been doing this for donkey's years in first aid, but it works because it will give you an order to follow. It'll keep you a bit calmer because you'll feel like you know what you're doing and you're doing things in the right order. So it's a really good idea to remember this. D-R-A-B-C. Danger, response, airway, breathing, and then either CPR or circulation. Some books say CPR, some say circulation. They mean the same thing. CPR circulates the blood around your body, so it doesn't matter which one you say, it's the same. So we'll start off with danger. Don't go running up to somebody. If there's any remote chance of you collapsing and lying there unconscious next to them, what's the point in that? You won't be able to help them, and then somebody else has got to come and help you, and there might not be anybody there to do that. So you've just doubled the amount of casualties. I know it's human nature that we all want to go running up to somebody to help them, but just make yourself for a couple of seconds go, okay, should I be going in there? Should I be going up to that person? Am I in any danger? And if you think you are, then you leave them. You've got to protect yourself. You're only useful to them if you're safe. So you may need to leave and call the police, call the ambulance and wait for them to come. If you're happy to go up to the person, then we need to try and wake them up. So at the moment, they look like they're asleep. They're not moving, they're not making a noise. So you're going to try and get a response from them. Shout at them, use their name if you know it, and shout things like, open your eyes, squeeze my hand, can you wiggle your feet, can you wiggle your fingers? You want them to do something physical, so give them an instruction and then look to see if they've followed that instruction, to see if they've heard you. You can almost also touch them. Be appropriate. On the shoulders is a good one, on the collarbones. You're doing it fairly firmly. You want to stimulate a response, but obviously, you know, don't shake them too much, especially if you think they've got a head or spinal injury. But pat them on the front of the shoulders. You could touch the face, rub the shoulder, squeeze the hand, squeeze the arm, pat the leg, anything to try and get them to respond to you. And you're looking for some kind of movement or some kind of noise, even if it's just a groan or a moan, or then they've heard you, they've responded to your touch, or they've responded to you shouting at them. So that means they are conscious. It's a lower level of consciousness, but they are conscious, which means they're breathing. So your primary survey would end there. I'd still definitely phone 999 because there's something wrong with this person. They're not 100%, are they? But at least you know that they're responsive, and that means that they're breathing. If there's no response at all, so they don't move, they don't make a noise, they're unconscious, they're unresponsive. So now I'll go down my list. And once you know that somebody is unconscious, the first priority is their breathing. Don't worry if you think they've got a broken arm, or you can see a minor wound on their leg or anything like that, a bit of bleeding. You can ignore those things. You are concentrating and focusing on whether they're breathing or not. Once you know they are breathing, if they are breathing, then you can worry about any other smaller injuries, but only focus on the breathing at this point. So the next one is airway. We have to open somebody's airway. Make sure they've got a good airway before we check for breathing. So when you're unconscious, which we now know they are, obviously all your muscles just relax, don't they? They just become like a dead heavy weight. Now this person's lying on their back. We want them on their back, so roll them over if you need to, if they were face down when you found them. So that means their tongue, it's a muscle and it's attached to your lower jaw. When you're unconscious, it falls back and blocks your airway. People use the phrase swallowing your tongue. I mean, you can't swallow your tongue. It won't get down to your stomach. It's ridiculous. But that's what they mean. That's what they're implying. Your tongue just falls back, which blocks the airway from the nose and or the mouth get into your lungs. So we're going to move that tongue away from the back of their throat, which it's not as hard as it sounds. Put 2 fingers right on the edge of the chin and your other hand on their forehead. And then we do 2 movements. This hand tilts the head back. These 2 fingers lift the jaw, lift the chin. So it's head tilt and chin lift. And we do it all at the same time. That movement will bring the tongue away from the back of the throat, and then they've got a clear, safe airway from the nose and the mouth down to their lungs. So open their airway. Hold it there while I now check for breathing. And checking for breathing is a check that lasts for 10 seconds. And we do 3 things. We look for the rise and fall of the chest, so look at the chest and the stomach to see movement of breath. We listen for breathing and feel it on your cheek. So get down, hold the head back, airway open, get down next to them, look at their body for movement, listen and feel while you're here. If you don't want to get this close to somebody, you are within their breathing zone here, then use your hand, that's fine, or get somebody else to put their hand there to feel for breath. That's okay, that's not a problem. So I'm looking, listening and feeling for breath for 10 seconds. What you're looking for is normal breathing. Give it that normal breathing. That's what we do on a daily, regular basis. So normal breathing is what I'm doing now. It's quiet, it's easy, it's regular, it's quite slow. That's what you're looking for. If you hear or see noisy, gaspy, gravelly, infrequent breathing, this is called agonal breathing or agonal gasping. That's not normal breathing. This person's body is starting to shut down. So please don't mistake this for normal breathing. So they might take strange gulps or infrequent gasps, or you may hear in their throat. That's not normal breath. We don't breathe like that on a daily basis. So we're going to class that as not breathing and we need to start CPR. So once you've established whether they're breathing normally or not by doing the 10-second breathing check, we then know whether we need to go on to C or not. If they are breathing normally and you're happy that that's the case, but they're unconscious, a good thing to do is put them in the recovery position because that maintains the safe airway. That's when they're lying on their side and their face is pointed towards the floor. So gravity will have an effect on the tongue. It'll keep the tongue away from the back of the throat to maintain that clear airway. And if they did vomit, it would drain away. Whereas if you left them on their back and let go of their head, the tongue will fall back, and if they vomit, they're going to choke on that. So doing the recovery position is a good idea for that. If they're not breathing, or they're not breathing normally, if they're doing that agonal breathing, then you're going to go down to C. You're going to do CPR. Make sure, once you know whether they're breathing, that somebody else rings 999. And if it's just you and them, that's the point at which you ring 999. Because when you call, the first question they'll ask you is the casualty breathing? So you've got to know the answer to that question before you phone them or before you send somebody else off to call 999. So if you've got a helper who's ready there waiting for instructions, do this, open the airway, look, listen and feel for breathing for 10 seconds. Then you can say to your helper, right, they're not breathing. Go and call 999, tell them that I'm doing CPR. So make sure you know the answer to that question before you call 999. It saves time in the long run. If they're not breathing or they're not breathing normally, we'll then go on to CPR, which I've covered in another video. I've also covered the recovery position in another video as well. So please feel free to go and have a look at those so that you know what to do once you've completed this. So I hope that's been of some use for you. It's a really good thing to keep into your head so you can act quickly and fairly calmly. We all panic, it's understandable, but you can act fairly calmly if you need to treat somebody who's collapsed. So if you want to find out more about me and the courses that I deliver, go to my website. It's skylarkfirstaid.co.uk, or I'm on Facebook and Instagram, and that's @skylarkfirstaid. Thank you.